of the things that I got an opportunity to do was to just see village life. I'd lived there for 2 years in Sierra Leone, but that was many years ago, and I was working in the British equivalent of the Peace Corps. So I was a VSO, was what we were called. And I travelled a little bit in the country too while I was there, and I've been back since. But there were some areas I'd never been to. And what was wonderful, being part of this delegation, we had access to things that we wouldn't normally have had access to. So, for example, we flew up in a UN helicopter up to the Koinadugu district, and we saw a clinic there and met with villagers and learned about the systems they've got for trying to help each other. And it was very moving to see to what extent they would go to try to help each other. So, for example, they built hammocks, and because the hospital was so many miles away and there was no transportation and the roads were often impassable, men would carry women, if they were about to give birth, on the hammock through the villages along those roads to the clinic, which is an amazing thing because it's incredibly hard to do even when you're not carrying someone in a hammock who also happens to be pregnant. So it was that kind of thing that I thought was really an amazing experience. I'd always known that people in Sierra Leone were extraordinary. One of the terrible things about maternal mortality is that so many women die needlessly. So they'll hemorrhage to death, for example, or they'll get an infection, or they'll suffer from something called fistula, which is a terrible condition and essentially means that a woman is plagued by all kinds of infections and so on until that can get surgically seen to. So, but yet it's very correctable usually. So we spoke to a lot of different women. I was lucky because I know a little Creole, and so I was able to speak to them. They were very patient with me because my Creole is actually quite terrible, but I can understand it much better than I can speak it, and so that was a wonderful thing to be able to talk to the women. And some of the women I talked to most were the mothers, and they were with their children because, of course, the follow-up care is the most important. And in Sierra Leone, many of the children die before the age of 2. So one place we visited was a large women's and children's hospital in Freetown. And I was very fortunate in that we went round to the different wards, and the mothers were there with their children, and they would talk about what they were doing for their children and how their children had got so much better, in most cases, not all unfortunately. And there was one of the most hopeful wards was the nutrition ward, where they would bring the little children in. They were toddlers, most of them, or younger, and they would feed them that peanut butter mix that is called plumpy nut, that was invented some years ago as a wonderful nutritional substitute for children. And so instead of trying to feed them necessarily the local things, they will use the local ground nuts and make a kind of paste that's very nutritious, lots of nutrition added to it as well, and then they feed that to the children, and it comes in these little kind of foil pouches. It doesn't need refrigeration, so it's ideal, and it saved, hundreds of thousands of lives, probably more than that. And so we saw the results of that with the children who were plumpy themselves after eating the plumpy nuts. One of the things that haunts me is a little boy who must have been about 2 or 3, and he was in the ICU in the hospital in Freetown, and in fact they're so understaffed and underfunded that the ICU is also part of the emergency room, and the children, there aren't enough beds for the ICU patients, so they have to share beds, the children. As it happened, this little boy had been very severely burned and was just on his stomach because he had too many burns on his back, ready to lie on his back. And his mother had gone to fetch something, and he was just looking up with a face that was so courageous and stoic. But you could tell that his burns were severe, And I remember how common that was when I used to live there, because there are open fires, there's really no protection for children. They have often run around barefoot because they can't afford shoes for the children, and so they're very vulnerable. And in Freetown in particular, they have these open sewers often, and so it can be very dangerous for children because there's garbage everywhere and metal and all kinds of things that they can injure themselves on. But it was this little boy's face that I remember always now, because it was full of hope, even though it was so sad. But looking at where he was, seeing that he was on the bed that he'd need to share, and in a hospital without any air conditioning, with people who were very kind and good. The nurses were extraordinary in that place, but they just don't have the kind of equipment and instrumentation that will allow them to really care for the children in the way they need to be able to do. CARE right now is, as you probably know, it's a huge humanitarian organization, and so it has many different kinds of projects, but one of its main focuses is maternal health. And because it's been identified by all of the nations in the world, really, as one of the most important issues for the next millennium, and for this millennium, I should say, and for the next 5 years, then many people are really focusing on it in new ways. Because I think there's been an understanding now that a society cannot flourish unless the mothers flourish. It just isn't going to happen. So you have to find a way to support them so that they will prosper, and in turn they will help their children. Lots of studies have shown that if you give anything to mothers, they will hand it on to their children. That isn't always the case with fathers, unfortunately, because they're not as bound to the children as mothers are. So if you want a society to flourish, you protect and enable and empower the women in that society. Because even if they're not mothers themselves, they often have a mothering role. It was partly their interest in mothers that made me interested in CARE, but also when I was in Africa all those years ago, in the late 70s I was only 21, and one of the organizations that I really loved was CARE, and I liked their approach because they utilized local expertise. So they would try to get in touch with the local people as much as possible, hire them, find out what was really needed. Some of the large organizations would come in and say, this is what you need. CARE didn't say that. CARE said, what is it that you need? That's a very different question. And so there were a number of different projects. One of them is a savings and loan project where small loans are given out to villagers who then can, say, buy oranges and sell them at the market and gradually become entrepreneurs that way. And so it's often on a pretty small scale, but it makes a tremendous difference to a community. And then there are health programs, education programs for women in particular, so that they'll know how to take care of their children, because there is often a lack of awareness about nutrition and how important that is if you want to protect the children and make sure that they do well. So those kinds of programs are things that they've been investing in with CARE, and I think they're extraordinary, really.